Welcome to the 2022 St. Elizabeth Volunteer Services Annual Training. If you're not already familiar with me, my name is Janellen DeLamba. I'm the Director of Volunteer Services in PrimeWise. You have selected the online training for Level 4. So I might suggest that you just double check the communication or letter that was sent to you. One, because the review answer sheet was included in there. And two, just to double check that Level 4 is the correct level for you. If you cannot find or can't locate your review answer sheet, that's fine. There should be a way to print it off of the website, our webpage, in the same area which you located this training. If you have any questions, please reach out to your volunteer coordinator. They'll be happy to help you. Now, if you also happen to be a hospice volunteer, in addition to being in a role which requires this annual training, please be aware that you do not have to complete both the hospice in-service and the annual training. Completing the annual training will suffice. And if you have any questions, please reach out to Debbie Halloran, the hospice volunteer coordinator. All right. I do always like to start out any of our annual trainings with a review, a re-emphasis, a recentering of the St. Elizabeth mission, vision, and values. So our St. Elizabeth mission is, as a Catholic healthcare ministry, we provide comprehensive and compassionate care that improves the health of the people we serve. Our vision: St. Elizabeth will lead the communities we serve to become the healthiest in America. The pillars of our strategic plan are there: people, culture, quality, experience, community. And we want to be the best, make it personal, and make it sustainable. Our values. So you know they spell I care. And I have to tell you, thank you every day for incorporating these into your volunteering. Innovation. I seek better ways to perform my work, find creative solutions, and embrace change. Collaboration. I understand that mutual respect and teamwork are critical to accomplishing goals. I work with others to achieve the best individual and collective outcomes. Accountability. I use resources efficiently, respond to others promptly, face challenges in a timely manner, and accept responsibility for my actions and decisions. Respect. I respect the dignity and diversity of our associates, physicians, patients, and community members. I promote trust, fairness, and inclusiveness through honest and open communication. Excellence. I believe in serving others by pursuing excellence in healthcare. I compassionately care for the mind, body, and spirit of each patient. So thank you for caring, for embracing the I care values and putting them into practice every single time that you are here at St. Elizabeth. Generosity. I think that is exactly what defines our foundation and all of the individuals who support our foundation. And through that generosity from individuals, from companies, and more than 150 community volunteers, the foundation is able to bridge that gap between the revenue that St. Elizabeth receives and the actual cost of meeting our community's critical healthcare needs. So the mission of the foundation is to inspire and connect generous community members with St. Elizabeth programs and projects dedicated to improving the health of our family, our friends, and our neighbors. So if you've been a volunteer for a while or just a community member, chances are you're very familiar with many of the projects that the foundation has spearheaded. There's the Fisher Homes Breast Center, the Carol Ann and Ralph the Hale Hospice Center, the Cardiovascular Mobile Health Unit, just recently, the Florence Wormold Heart and Vascular Institute, our patient network, St. Elizabeth Cancer Center, and we're in the process, since our vision campaign of 2020, of raising $8.2 million towards the next project. One of those is that we just broke ground on May 13th for the St. Elizabeth Dearborn Cancer Center in Greendale, Indiana. So this will enable better access for patients outside of Northern Kentucky to receive all those essential cancer screenings, the prevention, the treatment. It also offers state-of-the-art technologies, including on-site radiation oncology to treat that broad range of cancers, including breast, lung, prostate, and colon cancer. Construction is set to start soon, and the estimated cost is going to be $30 million. With that generosity, again, of our community, our donors, volunteers, and St. Elizabeth Associates, the foundation is making an immediate impact to improve the health and quality of life of all of our friends, neighbors, and loved ones. And we appreciate the contributions that you have made through your service. The St. Elizabeth Foundation has reached new milestones in generosity, with more than $100 million in donations raised in the last 30 years, but nearly half of that was raised only since 2017. Such a generous community. So the foundation wants to salute you as a dedicated volunteer. Your gifts of time and service to St. Elizabeth, you are an inspired giver. They greatly honor and appreciate your generosity. If you feel like you would like to add to that through a monetary donation, there are several additional opportunities available through the foundation. Please just reach out to them to learn more. And thank you so much, because together we make a lasting impact right here at home. Required review. So I want to start out by thanking you. You know, I so appreciate everything that you give and do, and continuing to choose to volunteer at St. Elizabeth. I think it's become very clear that there's more laws, rules, regulations, including continuing to, are wearing our masks than any other industry. So the more than ever, you are to be applauded for accepting that challenge. I see it every day, just how passionate you are about your role in making a positive difference in the patient experience. So thank you. As we get started, most of you are reviewing this or listening to this probably in the comfort of your own home. So please make sure that you are comfortable, because this is a little lengthy. And you can pause this at any time, I believe. So, and then once we do receive your answer sheet, we will record your time, your training time, to your volunteer record. So don't be worried. We're going to make sure that we note this. And if you have completed training in the past, annual training in the past, and you already know that this truly is a review. There should be nothing new. It's just an excellent refresher, important for all of us. So the Joint Commission, or TJC, they are the organization that accredits St. Elizabeth. If you've been around in the last few months, you know that we have recently experienced an accreditation. It is the Joint Commission that holds volunteers to the same standards as the paid staff. And so the reason that we are doing annual training today is because everyone is required to do that. And as I mentioned, this is really a review of policies and procedures with which you are all, and we all are familiar. So as I've mentioned, we just recently hosted a three Joint Commission survey teams. We had successful separate surveys for Florence, for Fort Thomas, and then for Edgewood, Covington, and Grant. Dearborn is on the schedule, but has not occurred. Confidentiality refresher. So, we all familiar with HIPAA by now, the Health Insurance Portability and Accountability Act. Its purpose is to establish protections for patient confidentiality, as well as security of electronic medical record systems and standards and requirements for electronic transmission of this health information. There are two parts to the Health Insurance Portability and Accountability Act. One is that privacy or confidentiality, and two is the security portion. So ensuring that the electronic record system and the transmission is secure, protecting us. Healthcare providers are required to train associates and volunteers on these regulations. So keeping it confidential. I like to say St. Elizabeth is like Vegas. What you see here stays here. So, and we really are required to treat everyone and everything that we see as confidential. So, and we all know patients are not just those in the patient rooms, that these rules apply in all situations, inpatient setting, outpatient setting, in waiting areas, on elevators and lobbies. Patients are not just confined in patient rooms. So we are required to have reasonable safeguards. And to that end, we do not discuss anything with anyone that you have observed while volunteering that involves a patient when you're talking outside of St. Elizabeth. Okay. We don't share with friends a situation that we noted with a patient that we saw when volunteering, even if we don't use names. We don't mention to our parents, our spouse, our friends, our priests that we saw someone in the hospital, because that is a breach of confidentiality and it is a HIPAA violation. I think I never question people because, again, going back to the I care, everybody cares about people. So when they're sharing a situation, it's out of caring. But the way that we can reframe that is it is our honor, it is our responsibility, it is our privilege to respect and to protect the people that we know and that we don't know, their confidentiality, and leave it up to them as to determine when and how and with whom to share their own private and confidential health information, as opposed to being in our hands. So there are penalties for noncompliance. Violations by St. Elizabeth Associates can result in disciplinary action up to and including termination from employment or volunteering with St. Elizabeth. You are personally responsible for access of any information if you have a login for any St. Elizabeth systems. You're responsible for anybody that would be using that. And additionally, we can be subject to civil and criminal penalties imposed by the federal government, including fines and prison. Now, we all know that this is the right thing to do, but it is also the law. Reporting concerns. So, St. Elizabeth has a corporate compliance program which requires each of us to know what's expected of us. We should all be aware of and obey the laws and regulations, which is a lot of the reason that we're doing annual training, is to keep us all up to date. Remind us. Ask questions when we are unsure of what the right action or decision might be. Speak up when we discover something that doesn't seem quite right, and support others' efforts to do the same. So you should report anything that seems unethical, including violations of patient, organization, or associate confidentiality, any HIPAA breaches, any kind of discrimination or harassment, any dishonest communications, including lying and obtaining goods or services under false pretenses, or any theft or misuse of organization supplies, equipment, money, or labor for personal use. How do you report those? Well, there's several different ways. First, you can contact the supervisor in the area where you volunteer. Now, if that supervisor is unable to solve the problem, then you can contact their supervisor, or you can contact the volunteer services staff. However, if you would prefer not to report the issue to a supervisor, you can call the corporate compliance officer, Lisa Fry, directly. She is, besides our corporate compliance, also our HIPAA privacy officer, and her phone number is in the phone directory. Now, you also may want to report a situation without revealing your identity. So if you want to do so anonymously, for those kinds of concerns, you can call the toll-free compliance hotline. And that is a 24/7. The number is listed here as well as in the phone directory. Now, this is run by operators from outside St. Elizabeth, so a different company. And you will be asked to make a complete report of the issue concern that you have. And they will take that, but they will send it to Lisa Fry, to the corporate compliance officer to resolve. Now, all these calls are confidential. You're not going to be traced or caller ID. You don't have to give your name if you would prefer not to. You can do that anonymously, or you can leave your name if you prefer a follow-up. So again, we don't trace any calls. Additionally, St. Elizabeth forbids retaliation against anybody who does report a concern in good faith. Making a good faith report will not put your volunteer position at risk. We protect every volunteer who reports a concern in good faith. Anyone who retaliates in any way is subject to immediate discipline up to including termination. So once again, report any retaliation concerns immediately to your supervisor or to Lisa Fry, the corporate compliance officer. So in summary, compliance is everyone's responsibility. We are all here to adhere to laws and ethical expectations to prevent noncompliance. So if you do detect potential noncompliance, you need to report it. And then we will work to correct all noncompliance and to protect patients and all involved. Health refresher. So hand hygiene. It is the simplest way to prevent the spread of infection, and it is the most protective practice one can use, period. So wash your hands, and wash your hands again. Most hospital-acquired infections can be prevented by thorough hand hygiene. So hand hygiene should be performed no matter what your volunteer position, several times during your shift. Hand hygiene can be performed using soap and water or the waterless alcohol antiseptic gels or foams. We always use soap and water after using the restroom, before eating, when hands are visibly dirty or they're contaminated with body substances or food. And when we're washing with soap and water, we wet our hands and apply the soap, of course, then rub our hands together vigorously for at least 10 to 15 seconds, covering all of our surfaces. So in between our fingers up to our wrists. And it is, that's at 10 to 15 seconds. And that can seem like an eternity. So sing happy birthday or row, row, row your boat or something to help yourself to get in that habit. Then you want to rinse and grab a disposable towel and then use that towel to turn off the faucet and to open the door before disposing of it. But waterless alcohol antiseptics are great when hands are not soiled, in which case you apply the foam or the gel to the palm of one hand and then rub your hands together, again, going in between your fingers and up to the wrist. And you want to rub until your hands are dry. That is what makes it effective. So again, it takes about 10 seconds. Now, the waterless alcohol antiseptics should not be used on hands that are soiled with organic material, such as grease or blood, body fluids, food residue, because then it isn't effective. Now, these alcohol antiseptics are available certainly in every patient room, in every department, in any St. Elizabeth facility, all over in many public areas. If you do not have access to any waterless alcohol antiseptics, you need to let your volunteer office know, and we will make sure that that is provided. Cough etiquette. I think by now we are very familiar with how respiratory illnesses, respiratory infections can be spread through coughing and sneezing, etc. So the very, very best way, the best practice, if you're going to cough, if you have a cough or sneeze coming on, is to cough or sneeze into your elbow or sleeve. And then you will contain what you see in that picture there. Be able to contain that within that sleeve. But some people do prefer or will cough into or sneeze into a tissue. In both cases, either way, you make sure you turn your head away from others. And then if you're using that tissue, throw it away into the trash, and then use hand sanitizer. Or if you did get some of that body fluid on your hands, if you're using that tissue, then you want to go ahead and use soap and water. Otherwise, the hand sanitizers. We use gloves when using disinfectant wipes to disinfect, whether it's wheelchairs or your phone or your keyboard or any surfaces, your workspace. Those purple-lidded wipes, as well as the Clorox wipes, are used. And whenever you're using a strong disinfectant, please make sure you put on the gloves. We want to protect you. And then the surface should remain wet for about 2 minutes, or the time that's on the label. And then we always encourage you to disinfect that work area when you arrive. So seasonal influenza. Fortunately, that's a few months off, but it's another highly contagious viral illness that is spread through respiratory means, through coughing, sneezing, contact with infected nasal secretions. So annual, as you are well aware by now, it's been several years that an annual flu shot or influenza immunization is required for all St. Elizabeth volunteers, associates, and physicians. We will provide you with a notice in September about where you can receive a flu shot at no cost through St. Elizabeth. So watch your mail. So protecting our patients from falls is everyone's responsibility. And it's not just patients, it's anybody, guests, visitors, fellow. Why is preventing falls so important? Well, they're among the most common hospital adverse events reported, and the danger of falling, danger from falling, resulting in death increases with age. None of those are things that we want anybody to experience. So there's 3 key steps. Be aware of environmental causes, notice when a patient or a guest is at risk, and take action to prevent the fall. What is a stroke? I'll bet everybody knows somebody who's had a stroke. Well, it occurs when blood vessels to the brain become blocked or ruptured. A stroke occurs every 40 seconds. Can you imagine that? Every 40 seconds. Stroke is the 5th leading cause of death and the number 1 leading cause of functional impairment. About 80% of strokes are preventable. Wow, that's a big number. Strokes can happen to anyone at any time. It is a myth that it only occurs with older adults. And a person who's had a TIA or a transient ischemic attack, I bet you might know somebody who has, they are almost 10 times more likely to have a stroke. All things to be aware of. So what are the signs of stroke? Well, you like to remember be fast. Balance. Watch for sudden loss of balance. Eye. Watch for sudden vision loss. Face. Look for an uneven smile. Arm, check if one arm is weak. Speech, listen for slurred speech. Time to call 911 at the first sign of any of those. And you want to call 911 because you don't want to drive, you don't want to delay. Call 911 right away so that they can begin treatment in the ambulance. St. Elizabeth, Edgewood, Florence, and Fort Thomas are certified by the Joint Commission as primary stroke centers. Covington and Grant are certified acute stroke ready by the Joint Commission. So if you see any of those warning signs, call 911. Heart attacks are another serious condition, of course. And heart attacks can actually have beginnings that occur days or weeks before a heart attack takes place. And that can happen in over 50% of our patients. So if recognized in time, these beginnings or these symptoms can be treated before the heart is damaged. Damage to the heart can begin 2 hours prior to the actual heart attack. And 85% of heart damage occurs within the first 2 hours of a heart attack. So kind of like that 4-hour period. So one of the big things you can do is to recognize symptoms. So the classic, I've got an elephant sitting on my chest, that chest pressure, that squeezing, the fullness or discomfort, pain that travels down one or both arms, sudden heavy sweating, nausea, upper back pain, shortness of breath, jaw pain, sudden dizziness or lightheadedness, unusual unexplained fatigue and or anxiety. They can be maybe combined with one or more of those symptoms that are listed there. Do be aware that people may not experience any or all of these symptoms, but these are the most common and they are important to be aware of. Now, women's symptoms can be more subtle than men's and may include some that are less common. So symptoms in women might be more nausea, vomiting, jaw, arm, upper back pain, chest discomfort, pressure, shortness of breath, syncope, sudden dizziness, unexplained or extreme fatigue. Again, people may or may not experience all of these or any of these symptoms, but they are the more classic. They're not to be dismissed. I'm just tired. I'm just short of breath. You want to pay attention to all of these symptoms. So if you notice one or more of these warning signs of a heart attack in someone off-site, at home, in the community, call 911. If you're in a St. Elizabeth hospital, 22222. You and I, we are the first link. We don't want to wait. St. Elizabeth is a certified chest pain center through the Society of Cardiovascular Care. Safe environment. Workplace violence. Unfortunately, this does happen, and unfortunately, we do hear about it. It is defined as any situation that may threaten the safety of a volunteer or associate, have an impact on any volunteer or associate's physical, emotional, or psychological well-being, cause damage to hospital property. So there are environmental risks that can all add to tension. So whenever you're in within a healthcare situation, it tends to be a little higher stress circumstance because something might not be right. So there might be gaps in communication, prolonged waiting times. So currently maybe the crowded waiting rooms, but currently visitor masking restrictions. Full range, and then there's always the fact that we are all very individual. We got our full range of personalities, how we handle things, and then noise and rules and lack of privacy. All of these things can add to tension. So recognition of risk factors, potential triggers, and warning signs are critical to your health and safety. So if you notice somebody's arms are held tight across their chest, clenched fist, heavy breathing, pacing, agitation, fixed stare, aggressive or threatening posture, sudden change in behavior. Those are all your nonverbal cues. But then those verbal cues, they start speaking loudly or yelling, shouting, swearing, using inappropriate language, or threatening tone of voice. These are all things that show that signs of escalation. So what do? You want to be empathetic. Identify with the feelings, thoughts, and attitudes of this person. Listen to their frustration. Be kind, be caring, be patient, be interested, be honest, be attentive, be non-judgmental. Kind of hard sometimes with the mask thing. What do they want that they are not getting? How would you feel in that situation? Can you address their concern or offer another approach? All to be considered. So you want to be on guard for behaviors that could indicate the potential for violent behavior. You want to communicate calmly, clearly, respectfully. You want to keep at least 3 feet of therapeutic space between you and the individual of concern. We like 6 feet of social distancing, but at least 3 feet. And if you feel threatened, immediately call 911. As soon as you can, safely do so, because you should not be in a situation of fear. And as always, report any acts of violence to St. Elizabeth, that you have experienced at St. Elizabeth, to Volunteer Services and Security, and of course your supervisor. Safety. So we may not call it code red, but if you detect smoke or flames of any type, you have to take immediate action. So pull the nearest fire alarm. If you're off site, you don't have a full fire alarm close by, call 911 and then go to the designated area where you are to gather so that people know that you are safe. And then you want to follow this process, RACE. So if there is a fire, you want to rescue and relocate people in immediate danger from the fire. Get everybody away from the fire. Then you want to activate that nearest fire alarm, pull that fire alarm and call 911 just to alert everybody in the area. Then you want to try to contain the fire and smoke. So if you can, close the doors and the windows, keep it contained. And then you want to evaluate and see if you can extinguish the fire if possible. Or if not, evacuate and escape the area as instructed or as needed. So that fire alarm pull stations, if you have them, they're going to be near exits and stairwells, as well as perhaps other places. Whenever a fire alarm is activated, the alarm sounds, and if there's any fire doors, they will close. Never, ever, ever put anything or obstruct the view of a fire alarm pull or a fire extinguisher. Now, a fire extinguisher is often your first defense in fighting a fire. But before you consider using one, please determine whether the fire is small and it's not spreading too rapidly, and then confirm that you have a safe path to exit. You want to make sure you are safe. So red ABC fire extinguishers are the most common, and they are used throughout our facilities. They are effective on A, B, and C type fires, but not D. So they are effective on combustibles, chemicals, electric, but not metals. So if you are going to use that fire extinguisher, get it off the wall. And first thing you're going to do is remember pass. So you want to pull the pin, aim the nozzle at the base of the fire, squeeze the handle, and sweep out the fire moving side to side. And stand about 10 feet away. So unfortunately, our country keeps experiencing active shooter instances. So it is important for you to think about what the most important thing and how you would react. So if you are approached by an aggressive individual but do not see a weapon, this is similar to what we just reviewed. You want to remain calm. It's not your first reaction, but it is the best reaction. Again, be aware of your posture, gestures, tone of voice, speed of speech. Keep your communication simple, supportive, positive, direct. Don't argue. Speak calmly and with respect and empathy, and then try calling 911 as soon as you can safely do so. But if it is an active shooter and you are off site, so you need to determine if you need to run, you need to hide, or you need to fight. In all cases, you want to call 911 as soon as you're able to. But if you're able to run, if you're able to leave the building and you can do so safely, do so. Then respond to your designated assembly point so that, again, your coworkers, your co-volunteers know that you are safe. If you don't think you can run, then hide. Barricade yourself in a room by locking the door, placing a large piece of furniture in front of the door, turn off the lights, silence your cell phones and pagers, and then try to stay low and stay there until the situation is over. But only as a last resort are you going to fight. But if you need to fight, you need to do so aggressively and use anything you have available as a weapon. Fire extinguisher, letter opener, full water bottle, umbrella, anything you can. Because if you need to do that, you need to fight for your life. Again, call 911 as soon as you're able. Diversity. So, bottom line is respect is the foundation of a culture of diversity and inclusion. Learning about those who are different from us is always an ongoing process. It's impossible to know everything and to be all aware. But respect is the tool in our toolkit that will work even when we don't know what to do. Respectful curiosity and openness to learn are very powerful and are always appropriate. So when you don't know what to say, you can try this. I want to assist you. Can you help me understand what it is you need? Please tell me more about that. If you ever feel like you have inadvertently upset somebody, a respectful apology is always appropriate. I'm sorry if I have offended you. I did not mean to do so. I want to do better. Can you please help me with that? Move the focus back to the individual because this is about them and not about you. So unconscious biases, sometimes also called implicit biases, and we all have them. That's just part of being human. So being able to quickly categorize people and react were once very important to the survival of our species. However, today, rather than helping us, implicit biases can get in our way of being open to all that we encounter. However, if we work to become aware of our own unconscious biases, we can then consciously decide not to act on them. We can decide to get to know each person as an individual, not see them only through the lens of a stereotype or a bias that we have formed. We have a multicultural environment here at St. Elizabeth. And so as a result, there's many different cultures operating at the same time, increasing the chance of misunderstanding the more that we interact with each other. Today, 1 in 4 Americans is a member of a racial or ethnic minority group. By 2070, 1 in 2 Americans will be. And there are currently more people over the age of 60 than under the age of 16. So we're already kind of touching on some groups that we may have biases about, unconscious. So a lot of the similarities and differences, and one of the ways that we differ is language and communication style. So the inability to communicate easily often increases the level of frustration, both for the speaker and for the listener. is an important factor affecting communication is our awareness of people who have limited English proficiency. So the same law that directs us to provide an interpreter for the deaf will also direct us to do so for people with limited English proficiency. So at St. Elizabeth, we have lots of interpretation options and resources. So now you can have an iPad or a tablet or even a smartphone that has an app on it for helping with interpretation, being an interpreter. But we have telephone, live video, in-person translators of written documents that they can put it into languages other than English, sign language interpreters, and all of that information should be available. If you have any questions, please reach out to the Volunteer Services Office, the supervisor, or our patient representatives. Another difference can be our size and shape differences. You know, in 2020, the national rate of adults with obesity was reported to be 41.9%. Oh my gosh, that's a big number. This is an increase of 11.4% since 2000, when the percentage was 30.5%. Now, both Kentucky and Indiana report high rates. But obesity is not just eating too much. It is a complex chronic disease that has many causes, including all of those things that you see up there: hormones, genetics, environment. And there is weight bias in healthcare. Nearly 95% of those with the disease of obesity feel like they have been discriminated against. So we're called to ask ourselves, am I comfortable with people of all shapes and sizes? Am I sensitive to the concerns of obese individuals? How might I feel if I was in the hospital and I couldn't get the gown to fasten in the back? If I overheard somebody saying, hey, we need the big chair over here, none of that would make me feel particularly good or respected. And we are committed to eliminating weight bias at St. Elizabeth. So what does diversity mean at St. Elizabeth? Well, diversity encompasses a collection of individual attributes and unique differences and similarities that our associates, patients, families, physicians, volunteers, and community bring to our environment. These characteristics include, but are not limited to, age, culture, traditions, national origin, socioeconomic status, veteran or military status, religious beliefs, sexual orientation, gender identity, race, physical and developmental abilities. I bet you can, I know I can identify with more than one of those characteristics, and I bet you can too. So we actually have a diversity, equity, and inclusion pledge here at St. Elizabeth. And it reads, I will support diversity, equity, and inclusion. I will not judge, but seek to understand others and their viewpoints. I will open my mind to learn about differences and treat everyone with dignity and respect. I will lead by creating a safe environment for everyone. I will make it my responsibility to act in accordance with the I Care values. Volunteer update. Woohoo! So save this date. I think that's about 7 months away. So our volunteer Christmas week celebration will be December 12th through the 18th. Please make sure, put that on your calendar, because we want to make sure you get your golden box of Esther Price from our CEO, Garen Colvin, along with some goodies from us. And just the pleasure of seeing you over the holiday. So remember that week. There's no better source of excellent volunteers than excellent volunteers. So each one of you are remarkable, and you also have the ability to share the word, because you are our best referral source. So please look around among your friends and neighbors, and if you see somebody that you think would be a good volunteer, please share with them about St. Elizabeth, encourage them. And if you refer a new person, once they begin volunteering, you will get a $25 gift certificate to be used in the gift shop. So just please help us to spread the word. We want to honor and salute our high school volunteer scholarship awardees this year in partnership with the St. Elizabeth Foundation, Florence Auxiliary, Fort Thomas Auxiliary, and the Second Time Around Shop. 20 $2,000 college scholarships were awarded to graduating high school volunteers and service interns. So we salute all of those individuals listed there. Thank you. Thank you for your service as a volunteer and or service intern, and best of luck. TB tests. So June is also mandatory TB testing time, but now for a couple years, there's only a select group of volunteers, a limited group of volunteers that have high patient contact positions that are required to complete the annual TB test. So anybody who has a level 1 position. So if you're one of those volunteers and you're required to complete this requirement, the letter that was sent out along with this answer sheet here include information on how to complete or how to get your TB test. So please just make sure that that occurs during the month of June. So late spring is generally when Volunteer Services sends out all of our current adult volunteers a survey, just asking them to provide us feedback about their experience at St. Elizabeth Healthcare. It is a confidential survey, and we can't trace it back. And we do ask that everybody be honest and share with us what we're doing well, what's going well with your volunteering, and what could go better. So either a survey link in an email or a hard copy survey was sent, in this case, it was in early May, to all of our active adult volunteers. So we'll look forward to sharing those survey results and responses with you, usually during the end of June, probably in the July newsletter. And also looking once again to see if St. Elizabeth is still the best place for volunteers to volunteer. So self-review, so in that mailing, that volunteer self-review is also included. And so we want to thank you for returning that required review along with this, with the Joint Commission review sheet that you'll complete at the end of this. But the self-review will be reviewed individually by the individual volunteer coordinators, and you can expect to follow up within 2 months if it was requested. If you did not request it, then that will not happen. But if there's any request or anything that looks like we could assist you in a better way, we will follow up. And then we also ask for your help in updating your contact information. So cell phones change, people drop landlines, email change, people move, emergency contacts change, children move out of state, etc. Please help keep our information current. Please update us. So June is also the $10 off uniform purchase month. So if you would like a new uniform or refresh a current one, now's the time to do it. You will get, you can have $10 off a uniform choice through the end of June. So just stop by one of the offices for some samples and to get an order form. So here's something every single person knows, is that you are the patient experience. And it is your passion and your desire to be a positive difference in that patient experience that makes you shine. One of the tools that we use is a communication tool called AIDIT. Something that I think, we might forget in between, but it's kind of common sense. And it is a tool for complete communication. So acknowledge We follow that 10-5 rule, and anybody's within 10 feet of us, we make that eye contact. Within 5 feet, we want to do, good morning, how are you today? May I help you? Just acknowledging. Introduce. So we want to introduce ourselves or our service. May I help you? Are you done? Would you like to make a purchase? Or, hi, I'm Janellen. I'm your volunteer here on the unit today. Just checking in to see if there's anything I can do. So introducing yourself or your service. And perhaps you need to provide a duration or a destination. So maybe you need to provide a time frame. Let me call the stockroom and see if we have that product available in that color. It'll take me about, if you have 5 minutes, because it'll take just a little bit of time. So you provide that time frame. Or if you, please go down this short hallway, turn right. Central elevators are about halfway down the hall on your left. Then take that to the 6th floor. That's providing directions that will assist somebody. And an explanation. So you and we can't explain somebody's CT scan or, what their lab work means. So we can only give as much information as we can. But we can do that, So once you reach radiology, please go up to the desk there. Make sure that you let them know you're there by signing in, and they'll take really good care of you. Or I do believe that you do need to visit registration first. So let me help make sure that you get there. And the reason is so that your insurance can pay for this. And then you want to conclude the conversation with a thank you. So lots of times the guest is thanking you, and we just say, oh, you're most welcome, or it was my pleasure to assist you. But perhaps you're saying, thank you so much for your purchase today. We appreciate your support. Or you're saying, goodbye, Mrs. Jones. Thank you for letting me visit with you. I really enjoyed our conversation. Whatever it is, you're bringing that conversation to a close. And why do we do these? Because they make a difference. When you acknowledge somebody, you increase their sense of security. They know I'm here. And you introduce yourself or your service, you decrease the anxiety. They know what your role is. They know why you're there. When you provide duration or direction, that increases the chance of a successful encounter. When I say it's on the left about halfway down the hall, they're not starting to look for it as soon as they turn down that hall. They're more likely to find it. Explanation always increases the quality of our experience. The more information we have, the better we feel. And then when you conclude or thank, it increases your satisfaction with that encounter, brings it to a satisfactory conclusion. And our number one best practice, regardless of where you volunteer, is nothing exceeds expectations in escorting a guest where they need to go. So they may have, they kind of expect anybody that has one of those hang tags where it says volunteer or RN to be able to tell them, provide them with directions, but you'll exceed expectations if you say, let me take you there. And even if you can only do it a portion of the way. Now, that's not always possible. We all know that. So we want to provide those clear directions. Generally, 3 steps is the most people can remember. And we want to refrain from pointing. We don't want to put our little pointer finger out there because that can be misread. But we can use an open palm. That actually feels very welcoming to have an open hand gesture or open palm. That's very, very well received. And our COVID-19 ever-changing, to some extent, COVID policies, although some things remain pretty consistent. As a St. Elizabeth volunteer, you are required to wear a surgical mask continually while volunteering. So we all know so not the St. Elizabeth kind of knit one or a cloth one, but a surgical mask. And we will provide those. We do have them available. And we do need you to keep it on continually while you're volunteering. Of course, the exception to that is if you're needing to drink or eat. Safety is the priority. We want to keep our community, our patients as safe as possible. And this is one way that we can do that. Now, we certainly understand if you're unable to manage that, if that's a burden to you, but then we will just ask you to, you'll be unable to continue to volunteer while the masks are required. So whenever possible, we continue to maintain that 6 foot of social distance. And we want to comply with all those distancing directions within the facilities, including hallways and cafeteria. But we also don't want to overcrowd those elevators. So just be aware. St. Elizabeth does require all volunteers, associates, and physicians to be vaccinated for COVID-19. You wouldn't be taking this annual training if you had not complied with that requirement, or to have received an approved religious or medical exemption. So I thank you. Currently receiving a booster vaccine is not a requirement for working or volunteering with St. Elizabeth Healthcare. However, it is strongly, strongly encouraged. And if you do receive it and you do have the documentation, we don't mind receiving or documenting that. So if you are experiencing any COVID-19 symptoms, please call your volunteer area and share that you will not be in. If you test positive, contact your volunteer office for the current return to volunteer process, and stay safe and well. So dress code. So our number one dress code piece is our badge. So we need you to wear that on your upper body at all times while you're volunteering. And if possible, make sure it's facing frontwards. The ID badge identifies you as a member of the St. Elizabeth team, so please do wear that. If at any point you would cease volunteering or need to retire or just are unable to volunteer any longer, we will ask you to return your volunteer badge to us. So as you're aware, St. Elizabeth is a professional environment, and the dress code for volunteers and associates reflects that expectation. So volunteers are required to wear their volunteer uniform whenever they're volunteering. It makes you easy to identify, provides that professional appearance, and there are some specific exceptions, but those positions are aware of who they are. So slacks or pants or skirts need to be a solid color, dress or casual style, ankle length, no capris or shorts, and not made of a denim, so no jean-like material, no denim, no nylon, no stretch pants, and no leggings. Shirts or tops, if it's not the uniform type like what is in the picture there, then a dress or casual shirt or top. So no t-shirts, hoodies, no sweatshirts, no sleeveless tops with the vest, no shirts with writings or logos except for St. Elizabeth. And then you can also use your uniform piece with all of that. So we all have cell phones. We all very much depend on them. And so we do ask, however, that they be on vibrate or silent when you are volunteering, because our customer service must come first. And if you must take a call or a text, please excuse yourself and move out of earshot. Never text in a patient room or in front of a guest. Your cell phone, your smartphone is not to be used to check websites or to play games while you are volunteering. Same with laptops and tablets. They're not to be used while volunteering unless specifically permitted by your volunteer supervisor. So your health is important to us. We need you to report any injury to your supervisor, and we need to complete a volunteer incident report. So we need you to inform volunteer services. Then depending on the severity of the injury, you'll be asked to either go see your own physician or go to emergency. And volunteers are covered under our St. Elizabeth liability insurance. St. Elizabeth will cover any injury related to costs incurred while volunteering, regardless of fault. You do need to notify the volunteer office if you are hospitalized, you're off for a medical reason, you have any COVID-19 symptoms or around COVID positive within 14 days, be under medical care for an illness or condition that impacts the health and safety, even if it's for a short period of time. Our hospital policy requires you to have a physician complete a return to volunteer form. And any volunteer office can provide you with that form. So we want you to stay well and safe. So here's some additional policy reminders. All volunteers need to act within the boundaries of their volunteer position description, accepting the direction of the supervisor where they volunteer. If you would like, if you're not familiar with your volunteer position description, please just ask your volunteer coordinator. She will be able to print one off for you so that you have a copy of your volunteer position description. And then please talk with volunteer services. If you have any concerns about your position, the supervisor, any issues, how things operate, things don't always go perfect. And we understand that. And we're here. We want to be where you go to express your concerns so that we can work through them and maybe we can get them resolved as best we can together. So please reach out to the volunteer coordinator and share if you have any concerns about your position or the area in which you volunteer. And you wouldn't be here if you didn't know this one. Complete all required training and health testing and immunizations annually. So volunteers can be dismissed for serious or intentional breach of confidentiality, misappropriation of funds, failure to comply with hospital policies such as abuse of alcohol or drugs, violating the no smoking policy, discriminatory or inappropriate conduct, and falsification of information given to the volunteer office, among other things. So, volunteer, you enhance St. Elizabeth every time you are here. You make all the difference. You are always passionate about your role in making a positive difference in that patient experience. And we benefit and appreciate your service each and every time you are here. All right, time to get out your review sheet. If you need to pause right now, please do, but make sure that you have printed your name on the top. And you'll not be using all the lines, just 25 of them. So let's get going. Number 1, I am familiar with St. Elizabeth's mission, vision, and I care values. A, true. B, false. Please put an A or a B on the first line. Number 2, the Joint Commission holds volunteers to the same standards as associates. A, true. B, false. Number 3, if you see a friend from church standing at registration in the cancer center, it is okay to call the church office and ask to put them on the prayer chain. A, yes. B, no. Number 4, HIPAA violations by St. Elizabeth Associates and or volunteers may result in disciplinary action up to and including termination from employment or volunteering. A, true. B, false. Number 5, St. Elizabeth is committed to being ethical in every way. If you think something isn't right, we want you to communicate your concerns. A, true. B, false. Number 6, if you have a concern to report, you may contact A, St. Elizabeth's Corporate Compliance Officer, B, the Compliance Hotline, C, your supervisor, D, volunteer office staff, E, all of the above. Number 7, the toll-free report line is open 24 hours a day, 7 days a week, and is totally confidential for the caller. A, true, B, false. Number 8, if you do not volunteer in a patient care area, then hand hygiene and disinfecting your work area are not important. A, true, B, false. Number 9, alcohol foams and gels are effective for hand hygiene on unsoiled hands, but are not effective on hands visibly dirty or contaminated with body substances, food, or after using the restroom. A, true, B, false. Number 10, you should always wash hands with soap and water after using the bathroom. A, true, B, false. Number 11, receiving an influenza vaccination, unless allergic, is an annual requirement for St. Elizabeth volunteers, associates, and physicians. A, true, B, false. Number 12, which of the following is a symptom of stroke? A, facial droop, B, arm weakness, C, slurred speech or difficulty speaking, D, all of the above. Number 13, if you believe someone outside St. Elizabeth is having a stroke, you should call 911. A, true, B, false. Number 14, if you observe anyone with the signs or symptoms of a heart attack outside the hospital, you call 911. A, true, B, false. Number 15, which of the following is an example of workplace violence? A patient who assaults a healthcare professional who is trying to treat him. B, an associate or volunteer who routinely berates and verbally demeans those with whom he works. C, the domestic partner of a volunteer who shows up at the hospital and threatens his or her partner. D, all of the above. Number 16, if you are a victim of workplace violence, you need to immediately report it to your supervisor or security. A, true, B, false. Number 17, St. Elizabeth has a zero tolerance for all forms of aggressive behavior. A, true, B, false. Number 18, if there is a fire in your area, what do you do? A, call the operator and move everyone downstairs. B, yell fire and allow people to go to another area. C, rescue anyone in danger, activate the alarm, contain the fire if possible, and extinguish the fire or evacuate. D, call security and put out the fire. Number 19, the PASS concept stands for A, medication administration procedures, B, the steps to take using a fire extinguisher correctly, C, safer driving technique on 2-lane roads. Number 20, St. Elizabeth Healthcare is committed to creating an environment of diversity, equity, and inclusion. We are all in this together. A, true, B, false. Number 21, I know that I am the patient experience. A, true, B, false. Number 22, AIDIT is a communication tool that stands for A, arrive, identify, deliver, edit, terminate. B, acknowledge, introduce, duration, explain, thank. Or C, announce, initiate, decide, educate, terminate. Number 23, I understand that we have a dress code and I am expected to wear my volunteer ID badge on my upper body whenever I am volunteering. A, true, B, false. Number 24, if you are hospitalized, off for a medical reason, or under medical care for an illness or condition that impacts your health or safety, even for a short time, you are required to have your physician complete a return to volunteer form. A, true, B, false. Number 25, it is okay to remove your surgical mask in the volunteer office when talking with others. A, true, B, false. Thank you. Woohoo! You have completed your 2022 annual training. So please take that answer sheet along with your self-review and bring those back or get them to the volunteer office, whether you scan and email them or you put them in the mail or you bring them into the office. We need those by the end of June. Thank you so very much.